And we begin with that breaking news on coronavirus. KU Med said it is treating a patient with COVID-19. The hospital is saying that patient is in a specially equipped area. It's designed to prevent the spread of the virus. Now, what that means exactly, we're still waiting to find out from doctors. Here they are speaking now to the media. Let's take a listen.
From asking those questions. Based on those premises, are there questions today?
Can you confirm whether or not this is a separate case from Johnson County?
What I can tell you is that I only know of one patient thus far that's been positive in the state of Kansas. Let me ask Lee Norman. Lee, has there only been one patient positive so far in the state of Kansas, or are there other patients? Lee, can you hear me?
Yes, one patient only.
Okay.
So I know it's
Yes, one patient only.
One patient only, so.
So
They can't hear me.
I know.
They can hear you
Right.
now.
Okay. I know we can't ask specifics about the patient, but
I don't think you could hear Mike.
Experiencing complications.
We can tell you that the patient's doing well.
Can you tell us a little bit more about this area, this space that the patient is confined to, kind of what that looks like, what this quarantine, how that all works?
You bet. I'm going to turn to Dr. Hawkinson. Dr. Hawkinson is the medical director of our infectious disease control and prevention team, and so he will address that question.
Yeah, so I'd like to state that for many years now, we have had procedures and protocols in place for emerging infectious diseases, whatever those may be. And we have been refining those procedures and protocols for the past few years. At this point in time, all of those procedures and protocols were followed very well, and the patient is currently in a safe area and under the strict protocols and procedures and isolation that is all recommended from the CDC and with guidance from the CDC and with the Kansas Department of Health and Environment as well.
Can you tell us if this patient had any contact with anyone else? Did they come through the ER? Was there any concern that they had contact with anyone else?
I'm going to turn to Dr. Norman as our public health expert and see if he has any comments about that, or also just about the health of the public in the general related to the coronavirus. Dr. Norman, the question is, did this patient come directly into the emergency room?
Sure.
Or be in contact with
The
others?
patient originated from a different town. I'm not sure they can hear me.
They can hear you. We got you.
They
You
came
guys
from a different city and flew into Kansas City. They had a mask. They had a mask on during their travel here. The only people that she was exposed to was her family members in their own home. When she went to the hospital, I understand that very appropriately she had a mask on and was taken directly up to the unit. So there's been a minimal amount of exposure and nothing without a mask on the patient.
And actually, if we could script this, we would say she did the best possible thing because she had called ahead our infectious disease prevention and control team, had arranged, she went right to a negative airflow room. This patient went right to a negative airflow room.
So after listening to Dr. Norman's answer, it sounds as though this is not the same person who was in Johnson County. Is there any way he can confirm or just kind of give us that little nugget?
Dr. Norman, the question is this the same patient that was in Johnson County?
Yes.
Why would a patient go from home isolation to hospital isolation? Is that symptoms driven, or what
All right, we're hearing now from KU Med officials telling us about a patient who has recently been checked in there that is testing positive for COVID-19, the coronavirus, and they have confirmed this is the same woman that KCTV5 first told you about this past weekend who was infected with the virus. So this is not a new case. This is the same case that we first told you about this weekend. Now,